Nigeria has been applauded after scoring 54% on its World Health Organization's Joint External Evaluation Performance Index on its capacity to prevent, detect, assess and respond to potential public health risks and emergencies. This is after a 5-day rigorous external evaluation exercise by WHO Africa region representatives to validate the score of the nation's internal assessment carried out about 3 weeks ago. Our correspondent, Idong Joseph, compiled this report.
The International Health Regulations of 2005 is a legally binding framework that requires all member countries of the World Health Organization to develop and maintain their capacity to prevent, detect, assess, and respond to public health risks and emergencies. This is monitored through a process known as Joint External Evaluation, which involves a team of experts assessing a country's preparedness and response capabilities across 19 technical areas, across ministries, departments, and agencies. 5 years after Nigeria conducted its first joint external evaluation for the International Health Regulations, Nigeria is now said to have made progress in improving public health security.
We were here a whole week to assess the health situation, the health security in Nigeria. And we had very frank and open discussions. The same was done 5 years ago, and Nigeria made a lot of progress.
At the end of the 2023 JEE, the ready score is now 54%. We have seen what appears to be a 10% increase in the domain for prevent, an 8% increase in the domain for detect, and an increase of 18% in the domain for response.
While the score represents progress for Nigeria's health emergency system, experts say many other gaps still need to be bridged.
The people who are working for you are professional and skilled, but they are understaffed. It is necessary that there will be more implementation of the plans that are made at the highest level to the local levels. You have to see that there will be more medical facilities, that there will be more medical staff, that your food will be safer.
Representatives of the Permanent Secretary of Nigeria's Ministry of Health and the Director General of the Nigeria Center for Disease Control pledged their commitment to improve on the success recorded so far and called for stakeholders' collaboration.
As a government, we want to assure everyone that we will provide that environment for us to continue with this journey. And to also state that the government is committed strongly to the principles of One Health. We are also committed politically to ensure that the recommendations from this evaluation will be taken to a higher scale.
It is not the time to rest on our oars or become complacent. Beyond the score, it is important for us to focus on the gaps that were identified, the priority actions as recommended, the priority activities that will definitely come in the detailed report.
While gaps have been identified, it is hoped that stakeholders will, through a joint effort, act to improve on Nigeria's health security.